All right, everyone. So we're going to go ahead and get started here in about 1 minute. If you could, please make sure you sign in into the chat in Teams with your name, organization, and email. And then we'll get ready to go here in about 30 seconds. All right, everybody. Seeing as the time is now 1:05, right? We're going to go ahead and get started. Right. So just making sure you're in the right place, right? So this is our technical assistance session for the New Jersey Family Care Housing Supports Program Readiness Program, right? Um, Importantly, today's session will be recorded. There will be a transcript available. There is a live transcript available if you need ADA assistance. And following this webinar tomorrow morning, we will post this webinar on the department's YouTube channel so that you can reference it, but also too, we will also link to it via OHP's website. All right, good, right? And go ahead and moving on, right? So as far as agenda and going into things, right? So your facilitators will be Jonathan Tu, right? Director of the Office of Policy and Innovation, New Jersey Family Care, Tristan Gibson, Office of Policy and Innovation, New Jersey Family Care, Renee Kubiatis, Senior Policy Advisor for DHCR here at DCA, myself, Michael Callahan, Director of the Office of Homelessness Prevention, Tina McGill, Assistant Director for Programs of the Office of Homelessness Prevention, Rita Marabelli, Program Manager of the Regional Homelessness Collaboration Initiative here at OHP, and Anthony Cassetta will be on tap, who is the lead contract administrator and head of office fiscal and contracting for the Office of Homelessness Prevention here at DCA. With regards to agenda, right? First, we're going to cover for those folks who aren't familiar. We're going to first we're going to cover for those folks who aren't familiar um, the incoming right the housing supports program as it is, and importantly too, we will also be covering the um, right, not just the housing supports program, but a little bit of history, and also too, there's some additional slides in here that no one has seen prior to today, which are really going to be important as you work through your due diligence as you move towards figuring out, right, not only scoping the program and your proposal that you put forward, but um, also to right some additional contacts, right, that's really going to set you up for success for that, right? Following that, right, John will hand it off to me and we'll take a deep dive into the Housing Supports Program Readiness Program and go into a detailed presentation, and also to go over a couple different use cases and a couple different examples of how you can, as an organization, leverage this opportunity. Lastly, right, myself and then Tina McGill will be taking over for the DCA Sage application training, right? We know that sometimes interfacing with our systems for administering grants electronically, or Sage, also known as Green Sage, can be sometimes a little troubling to engage with at the first go round, right? So we really want to dive deep into this. Following that, right, Tristan Gibson, myself, and Renee will be available after as for whatever remaining time we have left prior to 2:30 for additional questions for that, right? So going ahead and moving on, right? Happy to pass it over to my colleague John. John?
Great. Thanks so much, Mike. I appreciate it. So I am, as Mike said, going to talk through a little bit of the overview of what these housing supports are, that the provider readiness program and all the other efforts that we're doing between DCA and DMOS to get ready. What are they going to support? What are the actual services being delivered to Medicaid members that they'll support? So on the next slide, I have um, just a brief level setting for everybody. Oops, sorry, one back. Just a brief level setting for everybody on how we are authorized to deliver these services, because to someone not steeped in Medicaid, it could be strange that housing services are going to be a benefit delivered through New Jersey's Medicaid program. So real quick, NJ Family Care, which is the name of New Jersey's Medicaid program, is a federally and state funded, about 50-50 program to provide health insurance to residents of any age who need accessible health care. In New Jersey, that means about 1.8 million residents are on NJ Family Care, and that spiked to over 2 million during the pandemic. Most of our services are administered through 5 managed care organizations. Somewhere north of 95% of our members are enrolled in a managed care organization, and that'll become important in just a minute as we talk about how these services are authorized and delivered. And then just a note that these services that Medicaid provides is a pretty comprehensive health coverage program. So it includes your traditional doctor visits and hospital services and prescriptions, but also things like vision care, mental health, dental, nursing home care. It's a pretty comprehensive set of services that we provide. So under the large Medicaid program, CMS, the Centers for Medicare and Medicaid Services, which is our federal regulator, they offer to states what I think of as a menu of options from which each state builds its state plan. So each state Medicaid program is going to look different based on what that state's choices are on that menu. And then if a state wants to do something that's outside of that menu, they need to get what's called a waiver. The biggest, certainly in New Jersey, but amongst many states, the biggest is known as the 1115 demonstration waiver. And that's where states are allowed to, in partnership with the federal government, come up with innovative ways to deliver sometimes more traditional benefits and sometimes benefits that you wouldn't think of as traditional Medicaid benefits, but deliver them in innovative ways. States are able to experiment through 1115 waivers. They come in 5-year approval chunks. So when New Jersey, for instance, and the federal government are done negotiating an 1115 waiver, either application or renewal, it will be good for 5-year chunks. Currently, we're operating under our third period of 1115 demonstration approval. It began April of 2023 and lasts through June of 2028. And includes not just these housing services, but we are moving some behavioral health services into managed care. And we have several pilots that deal with everything from nutrition to community health workers. So a lot going on in this 1115 in addition to the housing services. So on the next slide, this is when we get into exactly what the housing services are that we're going to be delivering. So using that framework of authority and sort of grounding us in the idea of Medicaid delivering services like this, this is the one slide overview of what we are going to begin adding to the Medicaid program. The goals are to find and maintain housing for housing insecure Medicaid members with the explicit goal to improve health outcomes. And that'll become even more important later when I point out some of the eligibility requirements. As I said, it's approved through the 1115 demonstration, and we have authority through June of 2028. Certainly things like this are eligible for renewal, so we don't expect that 2028 is necessarily a hard deadline that housing services go away, but it's good to keep in mind that we currently have approval through that date. This is a statewide program. We're not going to be doing a rollout based on geography or any other sort of more pilot based. This will roll out to all eligible members across the state. And the services we cover are 4 main buckets. There's the pre-tenancy services. This is case management services that help a member find housing. Tenancy sustaining services, similar case management supports, but that help maintain a member in their home. And then residential modification and remediation. These are home mods to ensure that someone can stay in a home healthily and safely and healthily. And then finally, the move-in supports. And this is sort of those amorphous services around a transition that are necessary to get someone into housing, but aren't necessarily thought of as either tenancy sustaining or pre-tenancy services. In red, and we can't say this enough, we do not have authority from the federal government to pay for rent or the production of housing. So none of these services will be used to pay for rent for members. That's in part why we're partnering so closely with DCA on all aspects of this program, is that we want to integrate those programs that can pay for rent and make sure that we are a value add to make sure that members have all the housing services they need, not just the ones that we're able to deliver. So eligibility. As I mentioned before, a member must be MCO enrolled. There is a small percentage of our members who are fee-for-service only. They will not be eligible for housing services until they are enrolled in a managed care organization. And then those members have to have at least one clinical and at least one social risk factor. And we'll get into those in a moment of more deeply what those mean. But I think to focus on the fact that this is not just a program relying on a housing need, because we are a health insurance agency at heart, this needs to be linked to how the housing services can improve a clinical risk factor that the member might have. Provider qualifications, we have sort of two buckets, the pre-tenancy and tenancy sustaining services. Those are ones where these providers will have experience serving housing insecure populations. As I mentioned, case management. Think of the providers that are doing that work now, just not in a Medicaid context. They will be eligible to be those same types of providers here. And then for modification and remediation services, think of like a licensed home contractor. And we already have contractors of that nature delivering services in our managed long-term services and supports, or MLTSS program. And then move-in supports can be provided by either of those other two provider qualification categories. Finally, in my lightning travel through this program, the administrative model. We just want to make clear that the model, the framework from which we're working to deliver these are that the managed care organizations are responsible for building the network, paying the claims, authorizing services, the administrative functions of making sure that a member can access services. The housing supports providers are the ones that are actually responsible for delivering the services. And I think it's it's important to make clear that distinction, that we do have those two discrete roles in our managed care program to deliver these benefits. So on the next slide, I want to go through a little bit of an implementation update of where we stand, and then go a little bit deeper on the clinical and social risk factors, some of the services themselves. Like, we'll go a little bit deeper on some of those categories we just did. So implementation, we are finalizing right now the contract language with our managed care organizations that's going to give us the authority to work with them to run this program. We're working on program guidance for the managed care organizations as well as for providers, so that anyone interested in becoming a provider will have the guidance they need to join MCO networks. And very importantly, the MCOs will have the guidance they need to build the systems for those providers to insert themselves into. We're aiming for a go live, services beginning to be delivered in the first half of 2025. So we're going to spend the first few months of the year really getting ready for this launch. And I should say we will be more specific in the guidance as to a lot of these parameters. We have final CMS, our federal partner approvals that we still need to get in hand. Once we have those in hand, we can be very concrete about start date of services, things like rates that we'll get into. So some of these places where you hear us not having quite enough detail yet, that will all be coming soon when we get approval from the feds. In addition to the program design, we are making significant investment in making sure that providers have the training and the capacity building and the support they need to join Medicaid managed care networks. The focus of this call is the provider readiness grant, so I won't go too deep into that, but we're also partnering with the regional health hubs to provide trainings and technical assistance, and we'll get into that a little more as well. So that's another resource for you in addition to these trainings, in addition to the readiness grants themselves. And then, as I hope all of you have experienced, we've tried to have a really deep and meaningful stakeholder engagement process in all this. We have been meeting with stakeholders and potential housing providers for months. We have hosted a meet and greet recently in August between the managed care organizations and potential providers. We continue to meet with housing agency partners, other stakeholders. So throughout this, we have tried to make sure that we at Medicaid, who don't necessarily know much of anything about housing, are learning from you all that are actually doing it and making sure that we're bringing all of that stakeholder investment and knowledge into the program design we're doing. And that will continue. So on the next slide, this is the breakdown, a little bit more detail around each of the four services broadly defined. So you see at the top, the pre-tenancy services, tenancy sustaining services, move-in supports, and the modifications and remediations. I won't go through each bullet, but these are some examples of what those services could entail. One of those more detailed approvals that we're waiting on from CMS involves a much more detailed list of exactly what each of these services is, what is reimbursable, what is not. But these should give you an idea of, are the services I'm providing today, or are these services something that I could provide as a potential provider in the future? So on the next slide, wanted to give just an idea of the landscape. So we are not the first state to deliver housing services through Medicaid. We're sort of in the top half of states, maybe the top quarter. But this gives you sort of an idea of what other states have done in terms of rates that they're delivering to their providers. So for similar buckets of services, and I should clarify that PMPM means per member per month. So for the housing, for the pre-tenancy and the tenancy sustaining services, they will be delivered by providers, and then those providers will be reimbursed on a per member per month basis. So if you provide services to a member for 30 days, you will get the PMPM for that member for that month. What you see here is other states who deliver the services in this PMPM fashion, and you can see that the rates are all over the range, and I think this broad range accounts for different buckets of services that go into each of these states, as well as the nuances of just what each state and provider network and needs are. But you can see we range from about $330 a month to about $830 a month. So a broad range, but hopefully something that gives you a little bit to start thinking about as we wait for final approval of our New Jersey specific rates. We thought this would give you something to start targeting your thinking or refining your thinking a little bit more about how these will work. I'm seeing a couple of notes in the chat about slides being available. I think, as Mike mentioned, this recording will be up on YouTube, so you'll have access to all of this shortly. This is one different view, I think, of how you can map provider categories onto the services. So at the far left, you have the 4 services we've been talking about. We have the provider categories I mentioned before. So for the pre-tenancy and tenancy sustaining services, that will be the tenancy support provider. For this, think shelters, permanent supportive housing organizations, general case management organizations, any other CBO that provides that sort of tenancy services. That's who would be eligible to do that sort of work within a managed care network. And then home modification or remediation services, as I mentioned, is licensed home contractors. The move-in supports, that 4th service, that can be provided by either of the other 2 provider types. So we have pretty broad coverage and overlapping coverage of the services for those provider types. Great. So on the next slide, this is something I'd like to pause on for a little bit. These are the clinical risk criteria. And I think, well, these are the social and the clinical risk criteria, but I think the clinical risk criteria is the thing we might want to pause on the most here, because it might be the part that's most unfamiliar to an organization providing traditional housing services. At the very top, you have the 3 broad eligibility categories. Must be a member of the MCO, the managed care organizations, must have one of the social risk criteria, and must have at least one of the clinical risk criteria. Again, these are sort of broad buckets, and when we hear back from CMS, we'll be getting even more detail out on each one of these sub pieces. So this is meant to give you an idea of the types of things that maybe your existing clients or future clients, if they are dealing with a chronic health condition, you can begin to think this is someone who might be eligible for these Medicaid services if they're a Medicaid member and if they're experiencing one of the social risk criteria. So the social risk criteria, I think, are probably fairly familiar. These come from, in large part, HUD definitions around homelessness and at risk of homelessness, but we've added some other categories around transitioning into the community from correctional facilities or institutions. And then the clinical risk criteria, you can see a fairly broad spectrum, but the theme here is that we are tying the housing benefits to the, maybe not treatment, but the improvement of a clinical health issue the member is dealing with. So I won't read through the list, but these are the clinical risks that we have. And moving forward, those are the ways in which a member would be able to substantiate a clinical risk that would make them eligible for the housing services. Great. So on the next slide, wanted to talk briefly, as you can see on the left, grayed out provider readiness grants. We will get to those in much more detail, and is the reason we're all here. So skipping over that for a second, I wanted to talk a little bit more about the Regional Health Hub training and troubleshooting supports that we've worked to stand up. This is in addition to the provider readiness grants. And I just want to say at the top, as these have already started to be delivered, so please, through this presentation, if you're not already connected, let's get you connected to the Camden Coalition and the other regional health hubs to make sure you're getting those supports. But also just wanted to say this is not only available to providers who are applying for or who eventually get the provider readiness grants. If you are interested in becoming a Medicaid provider, these training and troubleshooting supports are for you, regardless of whether you are or would like to take advantage of the provider readiness grants. So on the next page, just a real quick description of what the regional health hubs are. If you're not familiar, we have 4 regional health hubs in the state. You can see them listed on the right. True to maybe their title as regional health hubs, but maybe not to their titles as organizations. These are regional organizations. They are not limited to the 4 metro areas that their name might imply. They expand beyond geographically those cities or those areas. So they cover a large portion of the state in terms of convening stakeholders, not just in healthcare, but around any other connected part of the community that could impact somebody's health. They work on not just Medicaid priorities, they work with many state partners, other state departments, and they are able to bring a breadth of community knowledge that is paired with their health information exchanges, where they have pretty deep data on the health information of members in their community. I say members, their information goes beyond Medicaid, so not just Medicaid members, but community members in general. And then they also have a deeply innovative role, so population and clinical health interventions that they see as being necessary to alleviating the needs of their particular community. That can be another focus of them. So on the next slide, they're taking all of that role and they are supporting, oops, sorry, I thought I had one more slide, but I was wrong. So staying on this slide for one more second. They take all of that regional expertise combined with data, combined with the convening of different sectors, and they're bringing that to the housing supports that they're going to provide. So when you get connected with them at this point through the Camden Coalition, you'll be able to access all 4. These are the ways in which they're going to train, troubleshoot, give feedback to the state on how it's going, give feedback to the managed care organizations on the pain points that providers are experiencing. They're going to be a great resource for anyone who is trying to become or sustaining being a housing services provider in Medicaid. So I see Colleen has dropped the landing page in the chat. Please go there for more information on getting connected to the hubs. And now I think I'm going to turn it back to Mike for more on the grants and the provider readiness program.
Awesome. Thanks, John. Real quick, just a measure of housekeeping. I think we omitted at the beginning, right? Please put any questions that you have in the chat. Right. So Tina from our team will go ahead and keep track of them, and we'll also kind of do them and engage with them sequentially as we go. As is often the case with these things, right? Oftentimes, an initial question you might have will be, answered a little bit downstream by some of the slides. But hey, there we are, right? So importantly. Right. So the overview, right? So the total amount of funding that we have available for this current opportunity is $10 million. So this is a $5 million state and $5 million federal match, right? The maximum award, right, is $250,000 per organization, right? To foot stomp the application due date, right? Your application must be received no later than 11:59 p.m. on the 16th of December, right? We're anticipating the grant term to start January 15 and go through January 14 of next year. We will obviously adjust those dates based upon the length of time it takes to get through contracting and fiscal. Right. Importantly, right, and the other thing to talk about is that, this will not be the first and only iteration of the program, right? We plan on doing more, right? We're just waiting on a little bit further guidance with our partners over at DHS from our federal partners on this, right, with regards to the program readiness grants. So importantly, the goals, right? In submitting an application, right? Um, there's really these 4 points that you want to keep and then have primacy, keep top of mind and have primacy as you go and not only scope your programs but get ready to submit, right? Remember, the intent of the Housing Supports Program more broadly is to help New Jersey Family Care members find and maintain housing as a mechanism of driving housing as healthcare, right? The purpose of these grants, right, are to support providers in becoming Medicaid ready, right? Importantly, if you do not wish to go after this infrastructure funding or this or the seed funding, right? There's nothing stopping you from providing and standing up a program to engage with the 5 MCOs to become a housing supports provider, right? This program, the genesis of this program really came out of a combined interdepartmental effort and having a scan across not only North Carolina, Oregon, Massachusetts, and some of our other sister states where, through providing the seed capital, we're really trying to get in front of some of the implementation issues that really act as blockers and barriers for the rollout of the 1115 waiver of housing supports in other states. My apologies if I'm a little clear. I'm a little bit under the weather right now, right? So importantly, right, the intent again is to build provider capacity for housing support services and also to drive connection between housing and healthcare systems. Right. What I cannot foot stomp enough, right, that not only your application for this, for the infrastructure support program, but also to, right, providing housing support services. If you plan on just standing up a case management team to do pre-tenancy support services that is going to operate by itself and not integrate into the larger health network and also importantly regional health hubs that Jonathan just touched upon, right? You're not going to be successful in this program, right? It is very much intended where collaboration is not only encouraged but rewarded, and folks that have a certain way of doing business and don't necessarily play nice with others in the sandbox, you might want to think twice about moving forward. So important, right? Eligible organizations, right? So nonprofit organizations that are one, currently approved by New Jersey Family Care for housing support services, or right, eligible for approval to provide pre-tenancy and tenancy support services. And then so organizations must have 3+ years in experience of at least one of these service verticals within homelessness and housing insecurity, meaning homelessness prevention, street outreach, emergency shelter provision, supportive services, or permanent housing services. Importantly, right, as we go through SAGE and when we go into the SAGE training type, right, there is a type of CBO which requires an elected member, so either a mayor or county official, to be on their board, right? Which is why you see that part in SAGE, right? If that is not applicable to your organization type, then please put NA and feel free to skip over that part. Similarly, right, when we talk about eligible organizations for this, right, we're saying applicants can leverage economies of scale and coordinate with national level or regional level organizations, right? And so when we talk about this, right, applicants taking this course of action must submit a local organizational level application. So this means is if you are engaging, right, with say a Family Promise National and you are a Family Promise affiliate, right, the application needs to come from the Family Promise affiliate, not the Family Promise National entity, right? Similarly, right, when we get to the part in SAGE where you designate consultants that you will be using through this opportunity, right, you're going to want to enumerate them and be very explicit about contact information and the services they are providing. Similarly, right, one of the things that we also want to foot stomp on are that any organizations taking this approach, right, must certify that any state funds utilized for the purpose will be for the sole benefit of New Jersey residents and eligible persons, and that will need to be memorialized in Section C of the finalized award contract. Also importantly, right, if for the purposes of the Housing Supports Program Readiness Program, or Provider Readiness Program rather, right, applicants may utilize the following HMIS systems, right? So either New Jersey HMIS, the statewide HMIS platform, Middlesex County's HMIS or Bergen's HMIS system. Right. Importantly, right, there is required MCO partnerships, right? So you must have at least one letter of intent executed with an MCO. There's a listing of the 5 MCOs. Following this webinar, once the video is uploaded, we will be sending out the slides. We will be sending out some additional collateral follow-on materials to include contact information for the persons that will be quarterbacking the LOIs for the 5 MCOs, if you have already not made contact with them. With regards to funding disbursement, right, we are through this program, we are leveraging a milestones-based process. And so what that means is once you meet all the milestones based in the application, right, you get an initial advance of 30%, you get a second advance of 30%, and then you get an additional advance of 30%. And the final milestones are the final 10% of funding, right? That being said, right. Organizations are more than eligible to submit FSRs if they're incurring costs beyond and in front, right, of that milestone-based cycle, right? And just as we're leveraging this to make sure you have enough cash runway to execute and become a stood-up provider, right? We want to make sure that we're responsive to your needs on this. Right. And so when we talk about key application requirements, right, there's executed MCO LOIs. There's a New Jersey Family Care Enrollment Attestation. And so that is a document that you put on your letterhead that that affirms, right, and attests to the fact that it is your intent to become a housing supports provider, providing at least one, either pre-tenancy or tenancy support services, right? Right, if you are a new organization, right, to DCA, to the department, right, 3 years of audits and in your latest Form 990, right, your bylaws and articles of incorporation, your staff resumes and org chart. Your staff resumes only need to be for the folks that are working on this project. Your current SAM registration, your all certification sheets, and any required attachments and narratives that are explicitly stated to be provided in the RFP, right? Importantly, right, we want to just flag for everyone, right, there's 2 core commitments that are required for anybody engaging, right, with this infrastructure funding. The first is you must provide, right, either your board's old resolution or affirmation of Housing First principles, right? And similarly, you must articulate in at least one, right, of the available and enumerated ways of how you are integrating person with lived experience and expertise, feedback, and shared decision making in your organization, right? So moving on, right, when we talk about the what this looks like, right? So really in this simple flow chart, right, understanding that moving an organization from the left all the way to the right, right, is that you are a community-based organization that's not ready to join the provider network due to infrastructure or some ramp-up requirements, right? And that you're going to leverage one of 3 spending categories in order to get to that desired end state, which is post that 1-year milestone process or sooner, if you're able to execute sooner, right? That your organization is able to be a provider of housing support services and is ready to enter the program in a formal way, right? And so when we think about, right, when you're thinking about, right, how you're engaging and how you're scoping out a program and what your needs are and doing that deeps needs assessment, right, you really want to be thinking about a couple questions, right? So one, how does your current service model align with the waiver's housing support objectives, right? What are current operational changes will we need to implement to meet program requirements? Do we have the necessary staff capacity and expertise to provide these housing supports, right? A good example here is, your rapid rehousing case manager might not be providing as robust services, right, as they're going to be necessary in order to provide tenancy sustainment services or even pre-tenancy services, right? There might be multiple training rounds that you might have to do with your team, right, or some upskilling that you have to engage in order to get your staff to that ready point, right? Importantly, how will we integrate with existing healthcare and social service systems? Again, right, through the housing support system, we are looking for community collaboration and integration, right? If you show up to a COC meeting once a year in order to, just get counted as participating, but there's not a lot of engagement or involvement with the system at large, right? This opportunity may not be for you, right? Similarly, what data collections and reporting processes need to be established, right? And this is beyond New Jersey HMIS or your regular HMIS, right? You're really going to have to take a deep dive and look at your data governance and also to right you're just regular reporting governance and other corporate governance functions that your organization engages in, but also to has on the books, right? As you move forward into this opportunity. Similarly, how can we ensure consumer choice and satisfaction in our housing support services? Right, as John alluded to, right, it's a per member per month rate, right, and reimbursement to that. But importantly, just like you are able to choose, right, your primary healthcare provider, your mental health care provider. A good example here is, you might see you might see a therapist that focuses on cognitive behavioral therapy, and you then go and find that, what, psychodynamic oriented therapy works better for me. And so you just switch providers and they both take your insurance and it's kind of seamless there, right? Importantly, the same thing is going to exist for persons that either experiencing homelessness that are New Jersey family care members or right persons that right have been housed but are a future risk of homelessness that are engaging in tenancy sustainment services, right? The element of consumer choice is something that is very new to a number of organizations, not only on this call but throughout the ecosystem, who for whatever reason, whether it just be the way that funding is distributed or the programmatic landscape in the state where, you are awarded a program and you are the operator of that program for a certain catchment region. That's not the case with this, right? You're going to have to be responsive not only to market factors, but also user experience and customer experience, right? And lastly, right, what partnerships or collaborations might enhance your ability to deliver comprehensive services that are really gonna enforce a substantive and positive consumer journey, not only exiting homelessness and so out of that homelessness into housing, but also importantly, um, right, ensuring that not only are health needs being comprehensively met, right, but that we're either ameliorating or resolving, some issues which, homelessness has necessarily exacerbated or increased the acuity of, right? So importantly, right, when we talk about the ceiling, like again, it's $250,000, right? This is a cohort-based competitive process, right? And we're going through milestone-based reimbursement. Right now, we're going to talk a little bit, right, about the three different categories, right? So the first category are really kind of thinking about that pre-program, right? So that's seed capital, right? And this is providing initial funding for immediate expansive needs, right? And so for when you do your deep dive into your organization and you're working with your board to do its due diligence, right? Many of you are going to come to the conclusion that yes, we need staffing, right? We're going to either need back office, middle office, or additional front office staff, so client facing folks, right, that whose tasks are directly tied to this, right? Similarly, there might be some equipment and supplies, right, that you're going to have to engage with and purchase, right, and some initial IT infrastructure. There's most often for most organizations throughout the state, there's going to be some preliminary training needs and also to some short-term operational costs for which, right, the seed capital could help offset, right? Lastly, right, many organizations, some of which are on this call, have already reached out to many consultancies and are currently in various stages of engaging with those consultants, right? Um, and oftentimes, right, navigating these waters on your own and thinking we got it, right, can often land you right in a bad place, right? While the state cannot endorse any consultants, right, or go and point you one direction or the other, right? We are able, to socialize you as an executive of your organization with other executives that are leaning in and engaging in a consultancy that for these seed activities, right? And the next phase, right, is really program readiness, right? And so first was capacity, now we're talking about capability, right? And so these are eligible activities, of which case, Medicaid enrollment, MCO contracting and credentialing. A good point here is for many community-based organizations that are doing work in this space, your attorney is the guy who or girl who is on your board who gives you 5 hours of time a month, because they're on your board and that's kind of how you offset, right? That's not really going to cut it, right? For you engaging right with Medicaid, you're going to want to have at least an on-call counsel or at least a dedicated counsel for that, right? And funding from this could support that, right? Similarly, right, specialized IT systems, right? Some folks are exploring EHRs or EMRs, right? Some folks are looking at their CMSs and adding on some additional functionality, right? And there's ways to, and you can definitely leverage this opportunity to make those purchases. Similarly, right? So there's additional compliance measures, right? And if you do not have SOPs on everything around your client and consumer journey, right? If you do not have an organization that is inspectable, where you would be considered a highly reliable organization or an HRO, right? You want to make sure that you're moving towards that, right? And part of that is you might just want to engage a consultancy and or another vendor, right, to help you source and create those SOPs if you do not have the in-house capacity, right? And as far as paying for that, right, that's a great point of payment there. Right. Billing and financial systems, and also to consulting services, right? We already covered part of that, right? But the billing aspect, right, it's going to be a PMPM, whereabouts, right, that the billing is going to land and look like, right? As you really take a deep dive, not only with, right, your CFO or your bookkeeper, and also to the treasurer of your board or some type of financial or fiscal oversight committee on your board, right? You really want to be doing your due diligence, because for many organizations, your revenue cycle is driven by a grant cycle, and now you're going to be moving to a revenue reimbursement cycle, right? And so offsetting the two or blending the two, right, is going to require a little bit of financial baseline knowledge, and importantly, right, a little bit more runway and operating capital than your current structure may already exist. Right. The next part, right, is flexible funds, right? And I always like to point out this was John's idea, and it was a really great one, right? But purposefully, right, we do not want to dictate to the community-based organizations and folks providing these services, right, all the categories or everything that's going to necessarily take to get you over the finish line to be able to provide these housing supports. Eligible activities for here, right, are community engagement, pilot programs, workforce development, capacity building for specific populations, knowledge sharing, and also do contingency planning, right? And so for some folks, right, the flex funds may just be, hey, we need $100,000 for a cash runway, because we're increasing our risk tolerance with deploying and going after this program and providing these services, and we just want to make sure we have that cushion for just in case, right? And so really want to foot stomp this, right? Because we've gotten some feedback and also too along the way, right? And so while this funding aims to help organizations become Medicaid ready, your total costs, right, based upon what some of the work has been already described to myself and our partners over at DHS, right, it may exceed, the $250,000 maximum grant amount. And importantly, right, we want you to consider this funding as one component of your overall transition strategy, right? And so a lot of organizations, right, are engaging in a concurrent development or capital campaign that's tied around this, right? You really might want to talk to your other peers, right, about why they're doing that and what that looks like, right, in order to maximize funding, but also to kind of socialize and talk about the impact to not only the foundations that you may be receiving funding for, but also to your just regular donor base, right? And so particularly, right, we want you to focus your application for this program on eligible expenses that are going to have the most impact on your organization's readiness for Medicaid billing and service delivery for housing supports. And as we talked about in the beginning, right, with that highlighted part, right, the purpose of this funding is to get your organization ready to become a provider when we turn the switch or shortly thereafter, right? And so here's three different scenarios and going through the funding, right? And so here's a small emergency shelter, right, that's expanding services, right? And so it's not the real Hope Harbor, right? I was just using Hope Harbor as an example, right? But so they currently operate a 30-bed emergency shelter in Camden County. They've got 5 years of experience providing emergency shelter services. They've got a small staff of 3 full-time employees, right? They've got a $500,000 annual operating budget. They've got a strong track record of case management and housing supports and placements, right? But they've got no experience with Medicaid, right? So how they are going and apportioning their spend, right? So they're going to go after $100,000 for seed capital to hire 2 new housing case managers, to purchase the necessary office equipment and supplies, and install basic IT infrastructure upgrades, right? Then they're going to apportion $120,000 to program readiness, in which case, right, that'll be a billing system that they stand up to do staff training on Medicaid requirements and just general operations. To engage with the consulting services for credentialing, they're spending $35,000. Do a legal review of MCO contracts, $15,000. And then they've apportioned $30,000 for flexible funds, right? And so $10,000 for community engagement activities, $10,000 for partnership development with healthcare providers, and then $10,000 for cultural competency training, right? And so importantly, right, the expected outcome of this is that you're transforming from a basic shelter provider to a comprehensive housing support services organization that's capable of billing Medicaid and maintaining sustainable funding streams, right? The next scenario, right? So this is a mid-cap organization, right, within our CBO landscape. And so within Community Housing Solutions, right? That currently provides permanent supportive housing in Essex and Hudson counties. It's got 10 years of experience in housing services. It's got 12 FTEs, a 3 million annual operating budget, and it's got experience with government contracts, but not Medicaid, right? So this organization, right, is leveraging $80,000 in seed capital to hire a dedicated billing specialist, so that back of house person. They're going to expand out their office space, right, in a flex rental agreement, and so that's $5,000. They're going to engage in some technology upgrades. That's $10,000, and then they are going to apportion the largest chunk of funding to program readiness, or $140,000, right? They're going to stand up an advanced case management system for Medicaid that is Medicaid compliant, right, for $60,000. They're going to engage in a staff training program that's going to cost $30,000. They are going to engage in MCO relationship building and contracting that they're projecting is costs of $30,000. And they're also going to be standing up a quality assurance system. And through that development activities, they expect to spend $20,000 on that, right? With regards to flexible funds, right, they're spending 30,000 on that, right? And for the first is to engage in a pilot program for integrated healthcare coordination with their local FQHC. And they're also going to develop a best practices manual that they expect and project is going to cost $10,000. And so just like before, when we talk about the intent of the funding, right, you really want to talk about the outcome and the end state that you're going to get to. And the end state for this organization is to scale existing housing support services while adding Medicaid billing capabilities to create a sustainable funding model for expanded services. Moving on, right, and this is our large cap organization, right? It's called the Urban Care Network, right? It's a comprehensive social services provider in Atlantic County. They've got 15 years of experience with various social services. They've got 50 employees, right? A mix between FTEs and some part-time folks and volunteers. They've got a $14 million annual operating budget. They are a current Medicaid provider for behavioral health care services. Right. So with what they're going to do with their funding and going after this is they've done an analysis of their needs, and in order to become ready to provide the housing supports, they're going to hire a housing program coordinator at $50,000. They're going to engage in marketing and outreach material development for $10,000, and they're going to purchase some initial supplies and equipment for $10,000. For program readiness, which is the largest chunk of the funding, right, they're going to integrate housing supports into their existing Medicaid billing system, right? And so they're going to engage with their CMS vendor to go and stand that up with some additional bucketed add-ons, right? They're going to engage in a staff cross-training program, right, across their constellation of programs and offerings, right? That's going to cost around $40,000. They're projecting that the documentation system updates that they're going to need as far as middle office and back of house, right, is going to cost right around $25,000. And they're going to expand out their compliance program to include these housing services, right, which is going to cost around $15,000 for the external entities that they're going to be doing business with there. Lastly, they're going to use the delta of $30,000, right, within that $250,000 cap, right, to develop, right, an innovative housing location service, right? So that's $15,000, and also to create a peer support program, right, which is going to cost $15,000, right? Again, if you look at the expected outcome, right, they're adding housing supports to their existing service array while leveraging current Medicaid infrastructure to create a comprehensive care model, right? And so when we look at the evaluation criteria of what we're really looking at, right, um, the proposed approach of how you're using the funding, right, that really is the lion's share, right, of what we're looking for and what we're asking you to articulate, right? The clarity with which you express, right, what you are spending funding on for what purpose to drive towards that end state of being a housing supports provider that is also engaging in sustainable business activity is going to be really clear, and you're going to want to clearly articulate it, right? And then particularly, right, when we talk about proposal quality, right? I cannot echo this enough, right? The best proposals that we always see, right, are always the ones that are submitted early, right? right? Ones that are submitted at the end of the day, or at 11:58 or even 11:59, right? We often see that it was rushed together and it was thrown at the last minute, and it really doesn't demonstrate the intentionality, right? That we're really looking for, right, with the expenditure of these funds, right? Um, so key takeaways, right, as you go and you scope out, right, things are we're looking the opportunity is comprehensive support for organizations to expand capacity, to meet Medicaid requirements, but also to implement innovative solutions, right? I think you've heard me say this quite a bit, right? But the focus is on you leveraging this funding to build sustainable infrastructure, right? For folks that are just looking for this to hire front of house staff to deliver services without any thought or wherewithal into your back of office or middle office, your business processes, right, or anything like that, right? You're not going to have that competitive an application, right? That being said, if you already have those functions, right, operational and they're doing really well, right, you want to make sure that you articulate that, right, and make sure that the review committee understands that you already have those existing resources extant in your organization, and that in going after front office staff, that is what is really going to be the accelerant for you being able to rapidly stand up and become an operational and sustainable housing supports provider, right? And then lastly, we really try to emphasize on tailored approaches that you have done your due diligence and a substantive engagement with your board and anyone else that are your constituencies or your stakeholders of where, hey, it's our intent to become a housing supports provider, right? We have a good idea of the roadmap that by which we're going to travel to get there, right? And we understand that we're going to leverage this funding to stand up the things that we cannot either engage in development activities or that we can't source elsewhere, right? Now we're going to move into everybody's favorite topic, which is DCA Sage. I'm going to go for a couple slides and I'm going to hand it over to my colleague Tina. Right. So importantly, right, with Sage, right, you want to double check the following, right? And especially for organizations that may have engaged or been the beneficiary of a legislative grant, 2 or 3 cycles ago, right? Your agency information, it has an expiration date, right? You need to go check in Sage. And if you have not registered for Sage, I strongly urge you to register immediately after this webinar, right? There is a lead time between when you register for Sage and when you are eligible and approved to go after applications, right? So if you're going after this funding opportunity, it would behoove you, right, to do this as soon as possible. Similarly, if there are no changes to your agency information, right, confirm that your agency information is up to date, right? Sage does not assume that there are no changes to your organization since your last application. Also, just to clarify again, this is Green Sage, DCA Sage, right? HUD also has a system called Sage. This is not HUD Sage, this is DCA Sage, right? You also want to ensure, right, that our Office of Compliance and Reporting, right, has not flagged your agency's audit. That is, it is expired, right? If you do have an expired audit, or for some organizations that have a lower revenue basis, right, your yellow book or other collateral financial documentation reporting, right? You want to make sure that you have submitted what you need to, right, at least 10 business days before the application deadline, right? Similarly, if your information is not updated, then the audit is past due, Sage will not allow you to submit your application, right? And the time to find this out is not, at 11 o'clock at night on the day of submission, right? You want to make sure you're doing your due diligence. You want to make sure you're ensuring that you can facilitate a good application, right? One of the other hiccups that we often see, right, with organizations are that the appropriate staff, right, are listed with correct email contacts at the proper access level for each organization, right? There are some organizations in Sage which have development directors pegged as financial officers, or that have case managers tagged as executive directors, right? And importantly, when we talk about responsiveness here in a little bit, right, we want to make sure that you are able to receive emails and those emails are getting routed to the appropriate party that has the decision-making authority or can contextualize and respond to either a modification request or a query for further information, right? Importantly, as many of you know, DCA Sage is a Web 1.0 system, right? But once applications have been submitted and the due date is passed, all traffic must be submitted electronically through Sage, right? Once the procurement and we have moved into curing any incomplete applications, right? All of those communications will be facilitated through Sage for the record, right? So that we can ensure that we're compliant with OPRA standards. And if you do not have the right contacts, right, listed out, right, then you will not be receiving those notifications. So remember, is your board list current? Right? If your board is out of compliance or has been inactive for greater than 120 days, we are unable to execute a contract and to make reimbursement or advance payments. Right? We want to ensure, and please double check this, and we'll show you where to here in a couple slides, that your board is in compliance and your board listing is current in Sage. Similarly, you want to ensure that your vendor number, which you receive through NJ Start, right, is correct and it's valid, right? Many organizations have merged, right, post-pandemic. Some organizations have ceased doing business or, right, they sold their book of business or whatever it has, right? You want to make sure that your information, that your New Jersey Start vendor ID is not only accurate, but it's also reflective in Sage with any changes. Similarly, right, we strongly encourage all of our grantees to be paid via ACH and not regular check through snail mail, right? Oftentimes that you're talking about the delivery of funds for that has a lead time of 28 to 48 hours when we're talking about ACH, and the differential between 10 and 14 business days if you're receiving a check, right? The place for that is updated is New Jersey Start. So please make sure that your organization is looking in New Jersey Start to make sure that that information is updated, but also too that it's also relevant for the current either general fund account, right, or wherever you are getting your receivables into. Right. And as we move through, right, if your vendor number is not correct, right, payment will be forwarded to the address currently in the system, and you may not receive it, right? And that's if you're awarded a contract, right? Another thing that we want to kind of foot stomp here, is that make sure your New Jersey Charities registration and mailing information is current, right? Please visit the Division of Consumer Affairs, right? That's where you should be registered, right? With New Jersey Charity, with a New Jersey Charities registration, right? And importantly, as part of the contracting and underwriting process, right? If your charities registration is not current, we will be unable to make a payment to you again if awarded a contract. Right. Some areas of the application that are often overlooked but crucial to the process, right? There's the resolution, right? Importantly, all of these documents that we're talking about can be found in template form in DCA Sage. And also as part of that, right, many of these documents are pre-populated with the information that you enter in, right, when you generate PDFs of that, right? So you really want to make sure that you're going through the sequence that we are prescribing in this this webinar. To that end, right, the resolution, and that is the resolution that your board is going to pass at a meeting, right, and with a sign or a notary seal saying that the board is supportive of this and they are affirming that your organization is moving towards becoming a housing supports provider with New Jersey Family Care, right? Please do not remove or add to the language, right? If a member of your council or anyone else's adds anything to the resolution, right, we're unable to move into contracting and you will be delayed, right? Similarly, it must be submitted as either a PDF or a Word document, and we cannot move into a contract without the resolution unaltered, right? Similarly, other areas often overlooked, right, are the certification for debarment and suspensions, known as the Schedule G and the templates in Sage, the certification against lobbying, which is your Schedule H document, your application cover page, right? Importantly, your application cover page is one of the last documents that you generate, right? And it ends up being pre-populated with a lot of the information that you enter in, and then you click the button to generate the PDF, you download it, and you either execute it via AutoPen or wet signature, and then you upload that document in PDF format so that it can go into the contract bundle, right? So one of these things, right, that you also want to pay attention to is your service areas, right? So any place that you plan on providing these housing support services and building infrastructure for, you must have a designated physical site within the service area to meet with the household as needed, right? For any other sources of funding, right? So if you receive ESG funding, COC funding, you're using home dollars for certain things, or state, for example, OHP programs, or other programs through DHS, so whether SHUSH funding or SSH, right? Or even local funding. So from a county government for county homelessness trust fund dollars, right? Private foundation or third party payer dollars, right? You want to list those for us in those sections, right? While it does not have to be an exhaustive list, right? We do expect that if you tell us you receive $6 million in annual revenue in grants and other funding to address homelessness and deliver services like pre-tenancy services, right? That you're telling us, right, where that sources of funding are, right? Similarly, in the Schedule A personnel, right, we're looking for the percent of hours worked to be equal to the percent of salary from the state, and the total dollars listed in the personnel equal to the staff time dollars listed in the budget, right? And so in talking about this, right, please ensure that your all application components, right, your project objectives, the scope of services, the narrative, agency capacity, and budget are in alignment with the RFP and correspond with each other, right? One of the things that we do immediately 24 hours after application or the first business day, right, is that all applications are reviewed for completeness, right? And we engage in communication through Sage to determine responsiveness to cure applications which have deficiencies, right? Importantly, non-responsive applicants, right, will be rejected without evaluation, right? And if you look in the RFP, the time window for that response, right, is there, right? Similarly, the state may also reject any application that is incomplete or where there are significant inconsistencies or inaccuracies, right? So importantly, right, this is what the Sage application looks like, right? When you go ahead and start it up, right? The first place you want to look is in view applicant information. That's the first place you want to click when you initiate a new application, right? And then in clicking that, it starts up 4 tabs, right? The first with your agency information, the next with your service areas, and the next, right, with your board of directors. As we talked about before, right? You want to make sure that your board listing, right, is accurate and that you have a listing of board members, right, that is not only accurate, but that is reflective of when they began their tenure with your organization, right? Um, and so with that, in order to add or delete boards of director, members of your board, right, you want to click the edit button, right? And as number 2 says on the slide, right, please make sure that your initial board appointment date, the start date, is listed, right? So when we look right within the left side of the application, this is the sequence, right? You start with program components, which then inform your service areas, which then lead to your program description, which then lead to your objectives and your scopes of services, right? And so you're going to list each program component separately, right? And we talked about there's 3 components, right? You want to use your program name, right? Not your agency providing services, right? For this, right, it would be how you could put New Jersey Family Care Housing Supports Infrastructure, right? You can get creative with that. But you want to make sure it's germane, right, to your organization, right? And what you're going to call this effort locally within that organization, right? If you need to edit or delete a program component, but you've already added budget money to it and a little bit further downstream and some of the other steps that we're going to talk about, right? One of the things that you're going to need to go do is say, for example, you realize, oh, we're not going to use any flex funding, but you initially defined flex funding and then you apportioned $50,000 for it, right? Before you can delete flex funding to your application, you must zero out that line within the component on the budget, right? And so again, list only services are eligible or components that are eligible in the RFP, right? And so it has to fall within one of the 3 buckets that we talked about earlier, right? Similarly, right, if you want to ensure that you have a program that is in one specific area and not an entire county, you want to indicate where you're going to be providing services, right? Again, you can have more than one service area. Also, for some organizations that are statewide, you can designate statewide for the entirety or totality of the state of New Jersey, right? Within program description, right, you want to make sure that this sentence starts with a lowercase 2 or 4. So even though it's wonky and you may get it auto-corrected, right, really, please try to make that a lowercase 2 or 4 with those prepositions there. Importantly, this gets directly incorporated into the contract that's generated, right? And you want to be as concise as possible in describing, right? Similarly, right, when we're talking about the services you are providing, please make sure that you're using person first language like vulnerable individual, persons experiencing homelessness, the unhoused, etc. Right. Um, with project objectives, right? This is the tab in which you enter that in, right? About and specifically, right, if you talk about the objective and end state, that those example organizations that we put up, right, you want to align each component with its objectives that are also aligned with the milestones in the RFP, right? Similarly, scopes of services, right? Through this, right, you should describe what you'll be doing, right? Operations, staff responsibilities, hours that will be worked, right? Staffing considerations, things like that, right? And so importantly, each organization operates differently, right? Do not assume that the joint review team, right, is going to know exactly what your program looks like, right? Please be as explicit as possible. Importantly, one of the things that we also like to say is that the narratives and some of the boxes where you can enter in text and string values within DCA Sage are character limited. If you feel, right, that you need to be more effusive or, to express in greater detail what that looks like, right, you are more than welcome to add an additional narrative language, right, which you can include as part of the third-party agreements, which is the catch-all buckets for where you upload additional documents, which we will go through, and you can include that there for further context, right? Similarly, right, if you are engaging with any consultants or there's a sub-grantee in what you're doing, right, and for the cases of the regional or national organizations that we're talking about, that we talked about earlier, you want to make sure that you're naming them there, right? And so after you've gone through the left side, right, you're going to go through the right side of the application, which is indicated by that arrow, right? The application statement forms is where you start, and then you end the budget overview, right? The application statement forms, again, if you look, right, there's statement of board president for the majority of organizations on this call, right? That will be, it'll be the statement of board president that you go and fill out. There's one organization type that is required to have an elected official, which is where you see statement of mayor or county official, which is why it's active, right, on Sage. If in doing so, right, that is not applicable to your organization, please put NA in all the spots and save it, right? And so this is where the statement of the board president goes, right? And so you click the checkbox, I'm in support of this application. You would enter in the comments of your board president, and you would also have that attestation, right, that you affirm that you are going to move forward with becoming, right, a New Jersey Family Care Housing Supports Provider. And similarly, right, with as much brevity as possible, go into the description and talk about how your board president should talk about that alignment there. Right, and this is really the meat of the project, right? So the project narrative, right? So the estimated number of people your program will serve whose incomes are at or below 125% of FPL, right? And this is just an estimate, right? Many of you understand, your current annual census and the metrics by which you operate, right? So please feel free to enter that number in there, right? This is the SAGEism, which is required across programs, which is why we can't get rid of it, right? Importantly, right, when we talk about, we'll list the needs, which illustrate the reason for the project, right? Traditionally, with programs, right, you are articulating to us the need for addressing either street outreach programs to address unsheltered homelessness in your community or something like that. That is not what you're doing here, right? You're illustrating the reason for the project being your narrative of you have done your due diligence and engaged with your board, right, through a substantive uh, project, and the product of that project is these gaps which you have identified through which you're going to leverage this funding to achieve readiness to become the housing supports provider, right? So it's a little different than your traditional application, right? Now, what is similar though is your agency's capacity to successfully execute the project, right? And so here you're talking about your agency's capacity to leverage the awarded infrastructure funding to execute, right, and contract with becoming a sustainable housing supports provider through New Jersey Family Care, right? And so there should not be a hierarchy or some recap of the thousands and millions of people that you've helped, right? This should speak deeply, right, to your executive team, to your staff, to your board, and the capacity and capabilities of any consultants you will be retaining, right, to get to that end state, right? And so please make sure that when you talk about capacity, you are framing it in that way, right? This is your Schedule A personnel, right? So importantly, if anybody is receiving, right, part of their wages or payments, for hours worked on this grant, right, the percentage of staff time must be equal to the percentage of salary requested, right? Importantly, if you will be leveraging funding to hire, right, staff as you work to ramp up, right, the name of employee, right, is to be hired. And instead of a resume, right, you are going to submit a job description. Right. And so Schedule B, right? This is the consultants tab, right? So you want to add all the consultants who will be working in a part of this project or program for you, right? Please make sure that anybody that you are contracting with or engaging with here, right? Whether it be McKinsey, whether it be KPMG, whether it be, Lowenstein Sandler, if you're engaging with them for your attorneys, right? If you're engaging with an outside consultancy to level up and do some IT development for you, right? You want to talk about who they are here, right? And list their contact information importantly, right? And so this is the other sources of funding, right? Please list out each, right, with type, right? And so importantly, right, in doing so, we want to make sure, right, that aligned with those pre-tenancy and tenancy support services, right, that you're letting us know, right, you receive these funding dollars currently for those services or for those service verticals that are adjacent to these, right? Importantly, your certification sheets, right? These are questions that you need to answer based upon your position, right? Right, following that position, right, they may or may not, right, be applicable, or they may or may not be affirmative or negative, right? Importantly, if your agency is new to the office, right, please upload your agency's 2 prior audits, scan as one document for number 6 and click yes. And also to be sure your board listing is correct and up to date when you certify number 7. Right. And so if you look at this page, right, these are the certification sheets, right? And so if you click on the green hyperlinked form, right, this is where you will be able to download the PDF version of your certification regarding debarment and suspension, your certification regarding lobbying, your resolution, right, and then your IRS determination letter and the application cover page. Importantly, right, you want to download these forms, execute them either via AutoPen or electronic signature if you have a CAC or PIV card, or you generated electronic signature via Adobe, or to WetSign, right? Again, please do not substitute these. We cannot move forward through contracting for that, right? Importantly, the application asks for a number of documents, right, which have no formal designated spot. In doing so, right, we ask, right, that any of the documents that you go and provide to us in response that are responsive to, right, questions asked within the application, that they're uploaded in a section called third-party agreements. Right. And so this is where all the documents that we're asking you to submit that have no designated upload link are submitted in the 2 drop boxes. Therefore, importantly, they have a limit of 20 megabytes each, right? So please use reduced size PDFs, right? If you come to submitting your application and there are documents that you have done your good college try and you cannot get them reduced, right? We will provide you with a MoveIt link through the state secure Dropbox to submit the application, right? Or the additional collateral documents. But please take note that we will require proof, right, that you made a good faith effort to upload elsewhere, right? And so if you run into that situation, please reach out to myself, Tina McGill, or Rita, and we will help resolve those issues, right? As said earlier, right, Form 990, all grantees must provide the most recently filed 990, right? And so that whether that be the full 990, the 990 easy, or the 990 November, right? We talked about the resolution, right? I think we're kind of beating a dead horse here, but particularly applicants may not substitute this resolution, right? It is required. This is what the resolution looks like, right? When you go and download the PDF, right, it is a fillable PDF. You will be able to go and enter in information there. And as far as executing resolutions, right, you can have the resolution wet signed, right, and scan and upload. You can also use AutoPen, and you can also use electronic signature via PIV, CAT card, or Adobe certified signature, right? Importantly, with regards to notarization, right, if your board secretary or attorney can sign it, right, it's not required to be notarized. If neither can do so, right, then a notary signature is required. And again, we cannot enter into a contract and a fiscal relationship until we have this resolution on file, right? Lastly is the budget overview, right? So importantly, right, the budget overview is where you add in, right, all of the listing and very discrete line items under those various program components, right? Please be as specific as possible, right? Specificity really drives great applications, while amorphous, nebulous, unknown, kind of, okay, well, we're going to spend $100,000 on flex funding with no additional context anywhere, right? It's not a good look, right? So importantly, this is an error message where if you go and see the application budget structure has not been set up properly, right? Or there are not any program application components. This is because you did the right side of the application prior to the left side, and that's why we ask you to do the left side first, right? Administration costs. So importantly, administration costs may be no more than 10% of total allocation, right? Any costs labeled as administrative, including under program line items, will be calculated as administrative costs and returned to the applicant, right? Again, right, budget line items are pre-populated based on what you enter under components. And similarly, salaries and personnel sections must equal the percent of funding under administrative costs, right? Do not bundle expenses. Itemize each budget expense using the available budget categories and provide details and examples of that line item expense. And again, the state may reject an application that is incomplete or where there are significant inconsistencies or inaccuracies, right? We see this sometimes when there was two versions of an application that were submitted and one member of a team submitted version A and the other one submitted version B, and they're just incongruous with one another when we go for review time, right? And so as far as a final scrub, right, one of the things to look at here, right, is there alignment, right? So with that, right, do your components, objectives, and budget coincide and align with one another and the intent and spirit of the RFP, right? Is it easy to identify each to its counterparts and the narrative you have constructed and put forth as how these spends are going to align and make you a sustainable New Jersey family care housing supports provider, right? Again, right, we are looking for not historical summary, name dropping of all the state senators, assembly people, and governors that you know, right? But we're looking for a demonstration of your capacity to undergo the spirit and intent of the RFP, right? We want to make sure that you do a final scrub to make sure that everything in the budget is within the guidance that we've set forth. And also to, again, just talking about the state may reject any application for missing or incomplete parts of your application. With regards to contractual requirements, right, there's insurance, fidelity bonding, and audits, right? Importantly, right, that's an error on the slide. Initial advance is going to be 30%, right? With fidelity bonding, right, that is something that you contact your current insurance provider, right? It should be something that they do what's called adding to your binder, right? For your total insurance package, right? You will be issuing a fidelity bond. They will issue a fidelity bond rather for your organization for the entirety of the initial advance, right? And that just ensures that, right, in case certain things happen or there's certain closures of the organization or other unforeseen circumstances, right, that we can ensure that we're protecting both federal and state money, right? Again, right, when we're talking about quarterly reporting periods, right, there are reporting periods that are aligned with this, right? They are standardized along Q1 through Q4, right? And of the state fiscal year, right, which starts on July 1, right? Importantly, right, you are able to submit for reimbursement through the FSR process, but you're also able to go through the advanced process that we've set up through the milestone achievement, right? Items to note, right? If your application is returned for modifications, right, and you receive an email through DCSH, right? You want to place a comment in the comment section within your application and the part that needs to be modified, and then you're going to click resubmit application, right? Oftentimes we get some folks that we end up pinging them or reaching out to them via phone, and we go and say, oh, we didn't know you. We resolved the issue that you flagged for us within DCSH, but we forgot to resubmit the app, right? This lets us go and engage in a timely scoring and contracting process, and we appreciate all of our partners that are responsive and get back to us as soon as they can, right? Just foot stomping the due date, right? So December 16th, right, 2024, right? And then immediately following this, right, we will upload the video to YouTube, and we will send out those collateral documents to include another copy of the RFP, this training, and this slide deck on top of that, right? So now we're going to stop sharing and we're going to move over to questions, right? And so Tina, if you don't mind, and I believe John's on, and so is right, John's on, and so is Tristan from DHS, right? So Tina, if you don't mind taking us through the chat and any questions, and then we will go from there. All right.
Real quick,
All
Mike, I
right.
think Tristan needs his mic engaged or
Oh,
enabled if he can.
gotcha. See, that's what
Thanks.
happens. You don't work for DCA. You don't work for DCA,
I
then
know,
you know.
we're not on the
Sorry.
inside.
Sorry, you're not on the inside. We like you, but we don't love you. I don't know what's going on. All right.
So
All
we
right.
have
Cool.
quite a few. Thank you, Michael. We have quite a few questions here. So I'm just going to skip around. Some of them are repetitive. So what's the difference between FFS and enrollment in MCO?
So excellent call out. Sorry for my over reliance on acronyms. FFS is fee for service, and that is how we reimburse providers who are billing for care they give members who are not enrolled in managed care. So for the very small percentage, again, above 90%, well above 90% are in managed care organizations. That's not talking about them. Fee for service is the small percentage of members we have that are not enrolled in managed care, and they would not be eligible for the housing services.
Thank you. Does the mental health have to be chronic, just like the chronic health?
I think this is referring to the clinical risk factors, and rather than diving too deep into each one of them, because there's a lot of detail below each one, pregnancy alone has several paragraphs of description. I will just flag that as soon as CMS approves our further descriptor, we will get it out to you. So use those as broad buckets, but know that much more detail is coming underneath each one of those.
John, do you want to talk too just about the observational and self-report criteria for that?
Yeah, that's a great point. So we are not trying with this to turn housing providers into clinical providers. So you are not going to need to get or pretend to have clinical expertise to be diagnosing something. This is going to be a self-report. The assessment form will ask you or your client, Medicaid member, are you experiencing that sort of question? And the approval for services will be based on that response, not on any sort of underlying clinical proof that you would have to submit.
Thank you. Is this only available to already established nonprofit organizations? What if a for-profit organization has recently set up a nonprofit? Will they be eligible?
Well,
Yeah,
can I
can
just
take that one.
just
Yeah,
separate the question into
Yeah.
two parts? There is the provider readiness grant, which Michael, maybe you can take, and then there is the ability to be a housing services provider, and that is more open. So, Michael.
Right, and to that end, that while that for-profit status would not exclude you, right, from maybe the more broad housing supports program, for the intent and purpose of this grant, right, it would exclude you for this funding.
Okay. All right, I'm going to skip down a little bit here. Do we need to use those HMIS systems for the billing or only record keeping?
At the moment, HIMIS is envisioned primarily for record keeping. I could see, there are futures in which HIMIS or other systems could be stood up to deal with billing, but that is not something that we're requiring right now. That's going to be more about the individual managed care network you're joining as to how they want you to be billing their systems. So HIMIS is going to be an important part of this, but it is not, at least at launch, going to be the billing platform.
Okay, and for domestic violence service providers prohibited from being in HEMIS, what system is needed? Which ones are comparable?
All right, so if you're an MPP provider, that's excluded. We can take that into consideration for the purposes of the infrastructure funding, and we can put out some written guidance regarding that.
Yep.
Okay, thank you. Do consultants need to be identified in the application, or can they be identified, selected after an award is made?
So importantly, there's a lot of lead time there, right? You're not going to go and engage with a consultant without having money in the bank to go and pay that consultant, right? So you're projecting that will be engaging with the consultancy. That's more than enough. You do not need to have an executed contract at time of submission of your application.
Thank you. Can the CBO become ready, meet all the milestones prior to the end date of the grant, and close out early?
We would love that. we would very much appreciate folks. We very much appreciate folks, moving as rapidly as possible. So.
Okay. Should providers utilize an EHR, electronic health record, in addition to HEMIS?
Yeah, John, you want to take on?
Yeah, I was going to say, this is going to be a decision that each individual organization is going to need to make. There are going to be requirements from the MCOs as to how you interact with their systems. But we at DMAS and DCA, we aren't going to be requiring any particular systems for you to join. So I think this falls into the bucket of you doing your due diligence around what's the best way for your organization to grow into these services, not any requirements in that area.
Okay. As a community action agency, we serve at or below 200% of the federal poverty level. Can we use this metric for the older stat of 125%?
Yes, that's more than acceptable.
You mentioned something about providers connecting with consultants, though you can't recommend anyone. I am a consultant. Can you clarify what you said?
Sure. So, I can't use this space to, if there's consultants that have joined the call, that's fine, right? But we're not going to engage in advertising here. So.
Thank you. Do we need to include funding received from DMAS services such as PATH and/or CSS?
I mean, I would. I would let us know that you're receiving those services. Importantly, John, do you want to just double tap and let folks know kind of that if they're billing for CSS, they're going to have to choose?
Yeah, so this is a good point to drill down on. If you are for instance, CSS provider, this does not mean you cannot be a Medicaid housing services provider, but I will just note the principle is that Medicaid will only pay for a service to an individual once. We cannot be paying under CSS for housing services and the larger Medicaid services. So it's not that you cannot be a provider of both services, but you will not be billing for an individual member under both programs. A member will either be a CSS provided service member or a housing services provider. There will be blocks in the system to make sure that billing can't happen. I think as a CSS provider, you would be well situated to be a housing provider, so I encourage you to do both, but just wanted to note that those are incompatible for reimbursement.
Should the LOI be addressed to your office, and is it required to include an MOU with the MCO?
It is not. So this letter of intent is literally a letter between you, the potential housing services organization, and the managed care organization saying, we've met, we have each other's contact information. That's really all we want, is just to make sure that you're engaged with an MCO. This doesn't rise to the level of MOU, MOA, legal document, no promises. We want to make sure you're in contact so that you are on their radar and they're on yours for future networks. And we have further guidance on how to get those letters of intent that we can send around as well. But it should
And
be a
just to
fairly
confirm-
low lift process.
I'm sorry.
Sorry, Tina.
No problem. Just to confirm, there is no match requirement.
No match. No match. It's free money, folks. No, I'm just kidding. It's not funny. It's your and my tax dollars being spent to help us end homelessness in the state of New Jersey.
Is the scope of services in this case referring to the housing assistance services we currently provide or the Medicaid services we intend to provide?
So the scope of services that you are outlining have to do with the infrastructure spend that you are doing, right? This is not what you envision as pre-tenancy services or tenancy support services. The scope of services in doing so is saying that, look, we are going to, in order for our organization to become a tenancy sustainment services provider or a pre-tenancy sustainment or pre-tenancy services and tenancy support services, right? Importantly, you can do only one. That's all right. Right. Importantly, you're saying you're having that statement, but then you're talking about how you are leveraging the components, right, in order to provide those services sustainably, right? And so we really want to get really discreet there and differentiate between an organization's vision of providing the services versus putting forth information of the steps you're going to take within the scope of this program to achieve that.
Is there a max salary fringe rate allowed for an organization or any flexibility in that area?
So we have not put out fringe guidance with this opportunity as far as limitations, right? Over excessive, anything that is beyond customary, right? I would say would be flagged for us, right? Customary being somewhere between, I'm not going to put a hard number, but usually we see fringe rates between 27 and 40 something percent. So.
What is the New Jersey Family Care Enrollment Attestation?
I'm not sure.
Right. So John, that's what we add. So importantly, that's what we're saying in the board resolution, that the board resolution.
Okay.
So that's the language included in the board resolution saying that you intend, through leveraging this funding, to become a housing supports provider through New Jersey Family Care. Right. That attestation statement is included within the resolution that you put forth. Importantly, right, we're going to have to take maybe one more question. If you put your questions in the chat, we can go ahead and follow up and send out answers immediately following this, right? But just want to kind of flag that for everybody. So Tina, what else? Maybe one more.
Okay. Does a nonprofit need to provide both pre-tenancy and tenancy services to be eligible, or can a nonprofit only provide tenancy services to be eligible?
You do not need to have to provide both.
That's right.
Okay.
Any or all.
Any or all. That's good. Thank you so much.
All right, folks. So please feel free, right, to enter in information into the chat. The chat window will not close if you have a question, right? We will be responsive to these questions, right? Unfortunately, some of us do have a conflict. We have to jump right following this, right? Thank you for your attention. Thank you for the very good substantive questions and engagement, right? And then John, any final words?
No, just really appreciate everyone being here. Thank you so much.
All right, take care, everyone.